I'm absolutely think that the publication of benchmark data is good for the system. At the time, it was very much meant to be driving choice. But patients, I don't think that's necessarily what is envisaged as doing that at the moment. So it's a good thing, but how you present that data, and more importantly, we always say this with data, don't we? How you use it. You need to be clear how data is going to be used before you share it, and the risks around use in order to determine what trust can or can't do, whether chief execs stay in role or not, or are big factors in this. And you're absolutely right, Matthew. The public don't, internationally, we know that the public don't really go to publish data in order to inform their view of health services. They talk to their neighbours and their friends and people who work in the health service who they know. But it has a massive impact on staff. So some of the biggest concerns that members have raised with me in the last few days who have been in the lower end of the table have been the challenges of chief execs, particularly those who may struggle to attract staff more. You talked about, we're talking about rural areas and some of the coast areas where it may be tougher to attract the staff that organisations need. That's the impact that I think is probably being felt more than some of the public scrutiny by leaders at the moment.